Greetings from the East Coast. Thank you so much for inviting me to be with you here today at the 2020 Summit for Medical Students and Family Medicine Residents, being brought to you by the California Academy of Family Physicians Foundation. I know we were all looking forward to being together in Los Angeles, but what a blessing it is to have the privilege and opportunity to reimagine the event rather than simply missing out. The nimbleness and adaptability of the CAFP Foundation feeds perfectly into what I would like to use my few minutes of fame to share with you today. First, a disclosure. I love being a family physician. If I had it to do all over again, I would choose family medicine every single time. So my remarks today are going to be clearly biased based on my incredible love, respect, admiration, and awe for family physicians all across the United States and all across the world. They are my people, and I couldn't be prouder to be one of them. I was the first one in my family to go to medical school, and aside from well-child checks, we rarely went in to see the doctor. When I went to medical school, in my mind, I was thinking I wanted to be a doctor like the one who took care of us at Andrews Air Force Base. He took care of my whole family, and I just wanted to be a regular doctor like him. Well, medical school taught me that what I call a regular doctor, the medical world calls a family physician. So the rest, as I say, is history. Family physician it is. That's my specialty of choice. I could tell you hundreds of little stories, but each one of them is going to end the same way. It ends with, and that's why I love doing what I do. That's how I know I picked the right choice. But if I had to take some time and just sort of reframe one story, the one that I would want to talk to you about today is reframing clearly the biggest story of this year, the pandemic from COVID-19. I found myself talking over Zoom not too long ago with a medical student who I've mentored for a long time from another university who was struggling a lot with her specialty choice. She shared with me that she truly enjoyed family medicine, but she was afraid to go into the specialty. She said she thought she wasn't going to have any opportunities, and it was just making her very nervous. And her advisors and mentors back at her home institution were just really cautioning her about going into family medicine. And in fact, one who she really trusts said to her, you know, a jack of all trades is a master of none. Who wants to be a master of nothing? Y'all, I had a deep sigh. I mean, a way down deep in your soul sigh, because I know this story well. I've heard it time and time again from medical students all across the country, and even from my fellow colleagues who heard it even back when they were choosing their specialty back in the day. I know that the story is used to steer excellent students away from the field, and I guess the people who are telling the story think they have good intentions. Unfortunately, I guess they've never really met a real family physician, because the things that they're telling them kind of aren't true. And so I thought to myself, how can I help her understand this? So I said to her, you know, I don't think I understand fully. Why don't you share with me what opportunities you were trying to do someday? Like, what is it that you thought you were going to do that you don't think you can do as a family physician? And she paused for a moment, thought, and then she said, you know, she wasn't really sure. She really wanted to keep her options open. I mean, she wasn't sure if maybe someday she might want to teach, or maybe she wants to do research. She might even want to be a leader someday. Maybe she wants to run a hospital or be in charge, like run the whole practice. She really, really wanted to make sure that people were going to take her seriously. And I can't lie to y'all, I messed up. I made a huge mental mistake at this moment because I cracked all the way up. Like I just started laughing from the bottom of my belly. I could not stop giggling because honest to goodness, I could not help but just find the whole thing hilarious. And I looked at her and I said, you do realize that you just described like half of my current day job, right? I reminded her that I work at an academic institution and it places a super high value on specialists and the care that they deliver. And then I shared with her a bit of my experience during COVID-19, which sort of highlighted what I've known all along about family physicians. During COVID-19, family physicians are who people turn to, particularly for guidance and support. We covered ambulatory practice, pivoted to telemedicine. We adapted and learned to play health so that we could take care of the health system and the university employees. We rounded on the COVID inpatient units, taking care of sick people right alongside our internal medicine colleagues. We partnered with community organizations to get food resources out to our community. We even were the people who they turned to think about how the system could figure out the safest way to be able to get testing done while keeping the patients safe and the staff safe. We were the ones they turned to when it came time to reopen the practice and figure out how we were going to be able to see patients safely in our practices again. We were the backup plan for nearly everybody in the hospital, except for surgery, because it very, very quickly became clear that while family medicine could indeed help cover the emergency room, the inpatient floors, including maternity, and the offices for adults and kids, no one, and I mean literally no one, could cover for us just them by themselves. There's not a single specialty that could step in and cover family medicine just on their own. And yet we could be anywhere. We could do almost anything. Even on a normal day in our health system, the chief medical officer, or the physician lead for one of our hospitals, the CEO of our employed physician plan, the CQO of our faculty practice plan, one of our medical school deans, all family physicians. And our influence isn't limited just to our institutions, not even just to our cities. Family physicians have prominent roles in government at all levels, are running for office, they sit on school boards. I even knew one who's a mayor of his town. Family physicians all across the country don't simply settle for being a master of none. No, they hone and craft a wide range of skills and talents, and they become unique family physicians. They become the family physician they want to be and who their community needs. Our specialty's commitment to lifelong learning means that as new things come up, as new skills develop, as new medications and procedures show up, we just pivot gracefully so that we can learn how to do that new thing. From technology like point of care ultrasound, all the way down to knowing the latest billing codes from Medicare, family physicians are on it. Family physicians lead, we teach, we research, publish, and present, we advocate, we deliver care to patients and communities. We stay ready so we don't have to get ready, and we step up when the need arises. And that's why I love being a family physician. It's not a job for the faint of heart. And you are going to be called to put in some work. But at the end of the day, you will rest well knowing that you are part of a family that is so much larger than yourself, working to change the world. And if anyone can do it, my bet is always on the family doc in the room. Thank you again for allowing me the opportunity to share.